A very warm welcome to segment 5 of our presentation on menopause. Today we're going to talk about one of the common conditions that occur during menopause, which is less talked about, is so much concealed that it seems like it doesn't even exist. But it's so prevalent that it needs to be attended in this section. It's urinary incontinence in menopause. Urinary incontinence is one of the debilitating conditions that affects most women in menopause. Almost 70% of women during menopause, they will have urinary incontinence. This condition, women don't talk about it, don't even tell their friends about it. It's like it doesn't even exist, while it's one of the problems that travels each and every menopause. Urinary incontinence in women. What is urinary incontinence? Urinary incontinence is involuntary loss of urine, leakage of urine. You don't have control of your urine. Urine just comes out. For it to qualify the definition of urinary incontinence that I'm going to discuss here, it must satisfy two conditions. This involuntary leakage of urine should be a hygienic problem. When I say it's hygienic problem, I mean it must be such that it either you are more often more soiled with urine, wet, such that you even smell urine, or it must be socially embarrassing. Socially embarrassing, I mean it must once or twice or more than that happen such that you are among people and you wet yourself such that you are embarrassed that people are going to see that while laughing at a joke or coughing, urine came out. Then it needs attention. That's what urinary incontinence I'm talking about here. Once in a while, every woman, when he coughs or sneezes, urine will come out, because the reason being that the urethra of a woman is a very short urethra. It's about 4 centimeters. Being 4 centimeters, the sphincters are so close to one another that they functionally function as the same thing. Unlike a man has got a urethra very long, about 12 centimeters, and a man has got additional protection from the prostate. Men and a woman, urogenital aging differ in this way. In a woman, as urogenital system ages during menopause, a woman presents with incontinence, while a man will present with retention, inability to urinate. A woman presents with inability to hold urine, while a man presents with inability to urinate. What are the predisposing causes? Things that makes a woman vulnerable to have this urinary incontinence. One of them is vaginal delivery. It happened mostly in those women who delivered vaginally, because during vaginal delivery, there is so much trauma to the pelvic floor and the sphincters, urinary sphincters, such that during involution, not all organs come to normal. The pelvic floor damage doesn't heal completely. And during menopause, due to estrogen deficiency and atrophy of the muscles, then the process occurs. While the damage happened 20-25 years ago, you're going to see the results now during menopause of the damage that occurs while you are still delivering. Normal process of aging is associated with estrogen deficiency, which is what menopause is all about. Ovary don't produce estrogen, so the muscles atrophy. And sometimes some people have got neurological diseases that affect the muscle, the pelvic floor muscles, and the urinary sphincter, such that the sphincter doesn't become competent. They become incompetent. They don't hold urine properly, and you've got incontinence. Some psychological diseases, like dementia, people don't realize that it's time to hold urine, then they become incontinence. To recap, the muscles, the pelvic floor muscles that we discussed in previous sections of this, these are the muscles that are affected by aging. They are affected by the process of vaginal delivery. As the baby passes through here, some of these muscles become overstretched such that they don't retract to normal length. As the baby passes, it opens the pelvic floor wide apart such that it destroys the sphincters, both urinary. There are several types of urinary incontinences. We're going to concentrate mostly on stressing urinary incontinence, which is the most common incontinence that happened during menopause. Another type of incontinence is urge incontinence, which can happen even before menopause, that one, because it's a neurological disease. It can happen after menopause or even before menopause. It doesn't have to do with menopause. But genuine stress incontinence is usually found in menopause because it's also a consequence of estrogen deficiency and menopause. Some women present with both mixed incontinence. You have got stress incontinence on top of urge incontinence. And sometimes it's difficult to differentiate which one is the predominant incontinence. And several tests like urodynamic tests have to be done to differentiate which one is the predominant incontinence. Some women have got urinary retention, chronic urinary retention, which is intentional or unintentional. If you keep your urine too long, feeling that your bladder is full and you keep on not going to the toilet, you will go into incontinence called overflow incontinence because now the bladder is overfilled. Say you are in a church, your bladder is full, but you don't want to go out. Maybe you are ashamed or you will say, okay, I'll go after church. The bladder might become overfilled and you have overflow incontinence. Functional incontinence is incontinence that happens because of a situation. So I say suddenly you've got a full bladder and you see a snake passing nearby, then you lose the urine. That's a type of functional incontinence that I'm talking about. The stress urinary incontinence said is loss of urine with increase in intra-abdominal pressure. Things that increase intra-abdominal pressure. Because of the damaged pelvic floor, which I said was damaged by mostly vaginal birth with weak or damaged sphincters, usually urinary sphincter, and added effect of aging and estrogen deficiency of menopause will lead to stress urinary incontinence. Symptoms of increased abdominal pressure, things that increase abdominal pressure, are things like coughing. When you cough, your abdominal pressure increases. When you laugh, abdominal pressure increases. When you're running, you're sneezing, or you lift a heavy object, sometimes when you're walking, your abdominal pressure increases. If your abdominal pressure increase the pressure on the bladder. If the sphincters are incompetent, then you have urinary incontinence. Just in this slide to see you, overflow incontinence, I said, is when your bladder is overfull and you have felt that your bladder was full but you didn't go to the toilet. It will reach a stage where the pressure inside the bladder will be more than urethral closure pressure and urine will come out. Stress incontinence is due to factors outside the urinary bladder that increase the pressure of the urinary bladder because it usually is increased abdominal pressure that is transmitted to the urinary bladder and force urine to come out. While I've said urge incontinence doesn't have to be during menopause. It can happen during menopause, even after menopause, maybe due to illnesses, infections, and neurological conditions, and so it can happen in anybody. Just for you to understand what urinary incontinence is, I want to take you through this.
Stress urinary incontinence in women. Urine is produced in the kidneys and stored in the urinary bladder. Urination is the process of emptying the bladder through the urethra that connects the urinary bladder to the external urethral orifice.
Urine is coming out.
There are two sphincters, or valves, that keep the urethra closed to prevent leak. Internal urethral sphincter, located at the neck of the bladder, and external urethral sphincter, located right above the external urethral orifice and is supported by the pelvic floor muscles. When the bladder is full, stretch receptors in the wall of the bladder send a signal to the spinal cord.
This urinary incontinence impacts the quality of life of a woman. The women tend to be withdrawn because of this incontinence. and you avoid social activities. You might even stop coming to church because you know that something might happen. The reverend might just crack a joke and you laugh, and incontinence come, or you might cough, incontinence come out. Well, this is because of fear of losing your bladder control. You have got this fear. And this embarrassment situation, it makes you become silent about it. You don't talk to anybody about it. You keep it to yourself. And that impacts your relationship, even with your peers in the Prayer Women's League, in all social activities, you get withdrawn. And in very elderly women, most especially, we see this thing in people who are in the old age homes. They are dependent on caregivers in caring for them because they are ever wet. And this irritation, urine coming out, sometimes it trickles through on the inside of the thighs and cause irritation, abrasion, and erosions there, skin irritation. And because of lack of knowledge about what's happening with these women, and because it happens mostly in women of the same age, they tend to accept that this is a milestone. At this age group, we must have urinary incontinence. So they accept it. They say nothing can be done about it. And sometimes because of lack of knowledge and limitation of resources, you don't know where to go to attend to this condition, then you remain with it. While it's actually a treatable condition, which if treated appropriately, a woman can lead a normal life without incontinence. As I said, usually in African, most elderly women, they think urinary incontinence is just part of your aging. It's a milestone. There's nothing you can do. You must reach a stage where you are incontinent and nothing can be done about it. And some people think the only solution is surgery, while there are a lot of solutions, surgical and non-surgical, depending on the severity of incontinence and the type of incontinence. Urgency incontinence, age incontinence is loss of urine due to involuntary muscle spasm, the bladder control voluntarily because of nerve stimulation or because of irritation by infection. I've said it can happen in menopause or outside menopause. It's not part of menopausal condition. And then the patient complained of the urgency, this irresistible urge to urinate, inability to reach the toilet. A person with urge incontinence, if she feels that the urine is full in the bladder and she goes to the toilet, the more she goes towards the toilet, the more the urge, and more often she urinates before she reaches the toilet. That is a urge incontinence. And it's got multiple triggers, many things that can cause it. They have to be caused by incontinence. By the time we reach the toilet, more often, when you are at the toilet, that's when urine comes, before you even see the toilet seat. Treatment, more especially I'm referring to treatment of stress incontinence, is conservative, the first approach. Bladder training. You train a woman not to allow a bladder to be overfull, to avoid stress and overflowing incontinence. Or you can just put panty liner or pads or even pampers so that should the urine come out, if it doesn't come too much, it can be absorbed by those absorptive pampers that she has put. But if it's too much, it needs one operation, small operation called bladder neck plication, which can be done to increase the functionality of the bladder neck and the bladder sphincter. Or sometimes the incompetent sphincter can be augmented by what you call a tape or a sling that pulls the bladder back and then restores the bladder neck, bladder urethra ankle, which is called uretrovesical ankle, and put it on the right place so that the sphincter can hold urine of adequate volume. The medical treatment doesn't work for stress incontinence. It only works for urge incontinence. So I've sent an addendum with this presentation because it couldn't fit into this presentation. It was making it too big, which I urge you to look at it to have a clear understanding of urinary incontinence in menopause. And I think in incontinence, the earlier you attend to it, the better the results. The more chronic it is, the poorer the results of. Thank you.